Hi, everybody. I'm so excited to be here and want to start off this presentation with a debt of gratitude and a heartfelt thank you to the Northwest Parkinson's Foundation for the continued opportunities to connect with you, our Parkinson's population, and to keep everybody connected and together through everything we've been through lately. So thank you. My name is Dr. Karin Duncan. I'm a naturopathic medical doctor here at Coeur d'Alene Healing Arts in Coeur d'Alene, Idaho. And I'm going to be talking to you today about a holistic approach to Parkinson's disease and what to expect from your integrative care provider. Right off the bat, conflicts of interest, I have none. I'm not associated with any supplement companies, any pharmaceutical companies, or any testing companies at this time. So right away, I want to start off with one of my favorite quotes that's been proven time and time again in my clinical practice. And it's, if you've met one person with Parkinson's, you've met one person with Parkinson's. And this is really why we're going to have this conversation today, is how do we treat each person with Parkinson's as their own individual healthcare treatment plan and approach. And so that leads us right into there's research, there's data on this to prove what you deserve is individualized, personalized healthcare. There's a paper that was published in 2021. It's listed there, and you can see the highlighted aspect there. It says treatment goals vary from person to person, emphasizing the need for personalized management. So Parkinson's disease is not one of an algorithm, and it's really important for you to know what you deserve and to know that when certain communications and conversations are being had with your provider, that this is indeed backed up in the data to say you do deserve individualized and personalized healthcare. So what's the why? The very first question that I always ask when I'm going to a presentation, when I'm listening to a chat is, why did you choose this topic? Why are we talking about this? It seems rather broad what to expect from an integrative healthcare provider. So I'm going to share with you why I chose this instead of diving into the weeds about certain, lab values or supplements that you should be using and things like that. But what I'm seeing in my clinical presentation is patients are walking into my office with a diagnosis of Parkinson's disease, and they're confused and they're overwhelmed and they're grieving and they're pessimistic and they're feeling a lot of despair. So many people will tell me, hey, I've been diagnosed with Parkinson's disease. I was put on this medication and I'm supposed to go back in 6 months. I don't really even understand what's happening in my body. And so they're Googling things and they're looking things up and they're talking to other people who've known somebody with Parkinson's disease. And so it becomes this really intense grief process. And they're not even really associated or intimate with their diagnosis yet. So some of the tools that I use to manage this clinical presentation is education, organization of what to do next and how to approach this, and empowerment, how to advocate for themselves, acceptance of the diagnosis, and also what that actually means. Hope, really, really important when we're talking to people with Parkinson's disease and a deficiency of dopamine, which kind of removes that ability to feel hope. So how do we instill that into them? And then, of course, advocacy. Really important to remember here, it's not an either or. Somebody isn't going to just be, oh, grief, and now I'm acceptance of this, and we're not going to go back and forth. It's really a both and situation, and making space for that inevitable moment where you're going to kind of lean back into some of these feelings of confusion and overwhelm, but knowing that you have somebody on your team that's going to help give you the tools to manage those feelings and how to kind of walk your way through this diagnosis. I'm a person of metaphors. If you're a patient of mine, you know that to be true. I love to use metaphors. Being an aviator in my prior life, this is one of my favorite ones. And when I say, what do integrative care docs do for you? And what am I doing in my practice? And really what I say is I get up to 20,000 feet. So I like to get us up out of the weeds in this, detail of how much are you taking and when, and all of those details are so important. But is anybody really coming up to look at you as a whole person, to look at that entire health picture and recognize what we need to do first? And I'm going to talk a little bit more about that here in a few slides. So what is an integrative care provider? What do you need to know? There are so many fields out there now that are considering themselves integrative, which gives you many options, which can be a great thing. It also can lead to overwhelm, confusion. So we want to give you guys the education and the empowerment here of filtering out in this field as well, who you should be looking for. Again, there's naturopathic medicine, functional medicine, chiropractic, acupuncture, Chinese, Ayurvedic, botanical, homeopathic. There are so many different modalities now that are really saying, hey, we are integrative care providers and we can help you with this diagnosis. So when you're going to choose, I really want to put, again, the power back in your court and say, ask the question. Just, you know, the famous quote from Office Space, what would you say you do here? Do you know about Parkinson's? Have you treated somebody with Parkinson's before? What are your outcomes looking like? There was just a study done over in Seattle there in Western Washington of all the care providers, both conventional and naturopathic, and the people with Parkinson's that they were serving. And it showed, is there a progression of symptoms? Is there a regression of symptoms? It's really important to know that not everybody is created equal when it comes to these specialized fields. So when you go into the integrative care world, ask the question, say specifically, do you know what dystonia is? Do you understand what I'm saying when I say on off? Can you manage medications? Can you prescribe them? Do you have this experience in treating this particular disease or diagnosis? And if you don't, can you send me somewhere that does? And that is where I would think the benefit is that we're really tapped in the network with each other in your area. So asking those questions, what do you do here, is really, really an important one before you sign on with a provider. I'm going to speak mostly to naturopathic physicians. That's what I do as a naturopathic doctor. And some of the things that we do, and I love the title of this slide here, we expand patient choice. So we are trained, in the pharmacologics. We know how to prescribe medication, and I'll kind of get into that a little bit later as well. But really taking that 20,000 foot view, a whole body approach. We know natural therapies from food, lifestyle, botanical medicine, nutraceuticals. We have over 250 hours of clinical nutrition through medical school. So really understanding that dietary assessment, nutrient therapy, and then the real big one here that has become important in my practice to understand is that the supplement drug interaction, supplement food interaction, and natural medicines as they kind of fit in there as well. Just because it's natural doesn't mean it's safe or benign or okay or indicated for you to take. So one of the things that I say the most often is just because your neighbor's cousin's brother's sister is taking this doesn't mean that it's right for you, even if you share the same diagnosis. So really understanding that there is data and research behind these natural medicines, and they're also, like I said, not always safe and benign or indicated for you. I can't tell you how many times I've had a patient walk into my office and I say, hey, please bring your meds and supplements in so we can take a peek at what you're taking. And they bring in their suitcase of meds and they dump it on my desk. And there's, no joke, 30 to 35 different supplements. And so really understanding what that means and what that's doing for your body and what it might not be doing for your body. Behavioral medicine, we're trained in counseling. We address lifestyle, psychosocial factors, your environment. Is it safe? Is it comfortable? Is it peaceful? Are you supported? Again, individualized care. Oftentimes your appointments with a naturopathic doctor are a little bit longer. So we get to know you a little bit better as a person and be able to facilitate some of that whole person care as well. And like I alluded to before, integrative partnerships, naturopathic doctors are really tapped into that integrative care provider community in your area. So even if that person isn't going to be your doctor or on your team, can we find resources and get you connected out there to the people that you need to be working with? This is a naturopathic therapeutic order. You can Google it and it'll come up in a bunch of different ways and shapes. And most often than not, it's a pyramid. I personally don't love the pyramid representation of the therapeutic order because it insinuates that we need to start at the bottom, and the bottom is good and it'll all be green, and then the top is bad and it's red. But really what we're looking for here is a top-down, bottom-up approach. So we want to use, the foundation for optimal health. Without a good foundation, it's just a lot of things aren't going to be working well, including your medications. And then going through each step in between and utilizing when you can. So I had a wonderful mentor in school, Dr. Christy Fleetwood. When they were teaching us this, it was, hey, we need to start here and move up. And she really gave this stair step analogy that I love, and saying, hey, you can start at stair 4 and you can go up or down. Or you can go up and down, and you can go 2 and 6 and 1 and 7, and really start pairing these approaches to somebody's individualized healthcare in a way that makes sense for them. And that's what truly makes it individualized. If we started from a bottom-up approach with every person, it wouldn't work, and therefore it wouldn't actually be individualized medicine. So my next favorite analogy that I love to make, or metaphor, I guess I'll say, is, and how I practice and what we do in naturopathic medicine is, once we've taken that 20,000-foot view and we've, assayed everything that we want to look at, and we've spoken to you, and we've learned about your life and your diet and everything like that, and then we know you have this diagnosis of Parkinson's, I always ask patients, I said, what's the closest alligator to your canoe? You walk in my office and you're in a canoe in the middle of the lake and you're surrounded by alligators. Now we've talked about all of them. What's the one that's going to eat you first? And really, that's where we need to start. And that's a wonderful tool to combat that overwhelm. Oh my gosh, I just got this diagnosis, but by the time you're 50, 60, 70, you've accumulated some diagnoses. That's just the burden of continuing to live, and the gift. And so really, I'm still trying to manage my thyroid. I'm, working on my diabetes. I just, came out of breast cancer surgery. I have this diagnosis. So really kind of teasing that out is, what is the closest alligator to your canoe? And we need to start there, because Parkinson's disease might be the biggest alligator for you upriver. But if it's not going to eat you first, then, we don't want to deal with that one first. So we'll get into this a little bit more, but keep that metaphor in mind as you're going through your healthcare journey and saying, hey, what is my alligator? What do I need to address first? So how do we evaluate the whole person? There are so many different, tests and interview questions and symptoms and things that we need to really be looking into carefully. But we look for underlying physiology. And without going into too much detail, there are so many different lab values and physiologic conditions that can overlap with symptoms of Parkinson's disease. And more often than not, what I'm seeing is this giant umbrella cast over Parkinson's disease. And they're saying, tremor and slowness and your stooped posture and your anxiety and your constipation and, joint pain. Everything in here is kind of lumped into this Parkinson's disease, and even the questionnaires, right? The non-motor screening questionnaire for Parkinson's disease includes a lot: urinary urgency, erectile dysfunction, loss of libido. So these things tend to be, all under this giant umbrella. And what I see happening so often is that patients will come and say, well, that's just Parkinson's. That's just Parkinson's. When really, what if it's not? What if there's an underlying nutrient deficiency that could help you feel just a little bit better? And at the same time, what if your thyroid could be managed and so you feel a little bit better? And the gut dysfunction, oh my gosh, the gut dysfunction. What if we could get your bowels regular and your toxin elimination more effective, and not have that stomach pain, not have any reflux, not have the bloating, again, constipation. What if we get those things moving? Wouldn't you feel better? Wouldn't Parkinson's, the alligator of Parkinson's, become a little bit smaller when we start addressing these other conditions? So yes, do they fall underneath the umbrella of Parkinson's? They can, absolutely. Do they always? In my practice, rarely. So it is something that we need to, like I said, step back and take a look at the whole person and how you're functioning. I'm looking at vagal nerve patterns, trauma history, environmental toxicity. Do you have any metabolic disorders, cardiovascular health, hormone health, mental health? Do you have family support and community? So again, we say whole person. I'm saying whole person. And there's oftentimes, in my visits with patients, I say, hey, you signed up for naturopathic medicine, so these questions do matter. And it's really important that we, peel back the layers of the onion there. Lab values is something that I do want to hit on here a little bit as far as what lab values mean. And I'm not going to go into too much detail about specific lab values, but I do want to let you know, again, educate you with the confusion out there, that there are lab values that are specific for people with Parkinson's, and they're not well published and they're not well adhered to. Some of the labs aren't even run from most clinical practitioners. So when we're looking at lab values, you want to make sure that your provider knows, hey, I get that I'm in the normal range, but am I within the normal range for somebody with Parkinson's disease, with my age, with this other confounding factor? Is there something else that could be contributing to my symptom presentation that we should be looking at? So these are based on research. These are based on so many different factors that come in to say, these are the lab values we're really hoping to get you to as a goal to optimize that physiology from that bottom-up approach. How do we optimize that physiology so that the symptoms of Parkinson's aren't all under that one umbrella and they're actually being addressed? In addition to that, oftentimes I'll say, those pictures that you used to look at, I don't know, 20 years ago, and it just looked like abstract, but then if you stared at it without looking at it, like a picture would come out of it. Oh, look at this picture. And so oftentimes, the provider, myself included, will look at labs and I'll go, line by line and see, okay, what's going on and what's abnormal. And then I take that step back and I kind of, look at the whole picture and say, this person is really just deplete. They're not outside of the reference range for anything. They're not abnormal. There's no red flags here. But when I'm looking at everything as a whole, I'm seeing that it just looks a little, and I use the word a lot, just, you're deplete. And that's not scientific. But if you don't have somebody looking at you in a creative and imaginative way saying, hey, here's all the things that are normal, go home, and you're like, hey, I still don't feel well, then you need to continue to ask questions, because so often I'll say, this just feels like this. And the patient will be like, yes, that's how I feel. So we kind of go back and we collaborate and we ask questions, say, does this align with how you're feeling? And just because this reference range works for 95% of the population that it was studied on, it doesn't mean it's going to work for you. So having that creativity when you're looking at the labs as well, and that ability to see the big picture is really important. If you're interested in learning more about labs, I have so many people wanting to know more about labs, and I send them to this resource. I actually recorded a video specific to lab values, and it's called Lab Values Decoded, and it's all about what we're looking for with people with Parkinson's, why, and what labs you should be asking your primary care provider to run for you. And you can find that through the Northwest Parkinson's Foundation resources. In addition to blood labs, we also will run some unconventional lab investigations. We're looking at hair toxins. Do you have a toxic burden? And here, why are we looking at toxic burden? Just two examples right off the bat. Most people with Parkinson's disease are going to be in their late stages of life. Postmenopausal women, you have lost some of your bone protecting hormones, and we store toxins in our bones. And so as that bone starts to deteriorate and leach out into the bloodstream, it's also leaching out the toxins with it. So are you actively toxic right now and in the midst of lead-based paint or something like that? Not necessarily. And that's why a lot of times these labs will get dismissed. But are you slowly leaching toxins out into your bloodstream? Potentially. And can those create neurologic conditions that are similar to the symptoms of Parkinson's disease? Yes. So it is something that we look at, and I really will investigate this. One, if I'm thinking malabsorption or some sort of GI issue where we're not getting these essential elements that you can see there at the bottom. And two, if somebody is medication resistant, kind of regardless of what we try or how we try it, let's look and see if there's some sort of other obstacle that's keeping your body from assimilating to your medication. The other one we look for is, a SIBO test, small intestinal bacterial overgrowth. When there's slow gut motility and constipation and this toxic buildup and a lot of stress and vagal nerve dysfunction and all those things kind of combined, we're looking at like a dysbiotic state of the GI tract. And we can do this through a breath test analysis. We can do this through a stool test analysis. It just kind of depends on severity of symptoms and what you feel like is going to benefit you the most. But these are unconventional labs that have been proven really effective and helpful, especially, for the patients that I work with. And I can say, really confidently that once we treat the gut in my practice and we get things moving and we start to heal it, I've seen patients in my practice be able to reduce their medication burden by 30 to 50% and still manage their symptoms even more effectively than prior. So these are really, really valuable for your overall metabolic health. One more metaphor for you all, and really what I'm trying to wrap up here in a little bow is that, is Parkinson's disease and all of those symptoms that I mentioned that are under that big umbrella, is this giant suitcase that you're lugging around with you every day, like everything I'm going through is this? Or can you throw on Parkinson's disease in the morning like a backpack and go about your day? And that's really the goal here. I'm not sitting here with my Harry Potter wand saying, I'm going to take Parkinson's disease away from you. I'm not. And also, if I can sit here and say, I can lighten the load and your burden by caring for your entire body, not only, your physiologic health and your biochemical health, but how you relate to the diagnosis, how you're supported, how you are, feeling, what your spiritual health is, what your mental health is, and really help lighten that burden, then Parkinson's disease becomes a backpack or becomes a smaller alligator. Or maybe the alligator just kind of turns around and swims away and says, I'll come back later. And it's not really something that we're worried about every minute of the day. So when I chat with patients, I really like to set that expectation that I'm not here to cure anybody. I am here to improve your quality of life to the extent that you can throw on this diagnosis in the morning and go about your day. So what comes first? I think I have to move this little window because this is an important quote. So I doctored this up a little bit. This was an image, of course, I downloaded from the internet, and I was looking for foundations, tell me foundations. And we looked at that stair step approach before, the therapeutic order. And I said, hey, we can start at any stair there. But really what I should have said is we can start at every stair and address the foundations. You can start at high force interventions, and you have to be addressing the foundations of health. Again, countless conversations with countless people with Parkinson's. Are you drinking enough water? I know you're constipated. I know this is happening. Are you drinking enough water? No, but I'm still working on it. I mean, the simple fact is if you're not, some things are just not going to improve. So without addressing the foundations of health at every visit and revisiting that and making sure that you're staying intentional about it is really important. And what we're seeing so much these days is this kind of foundation. Okay, well, at least you have your meds, so you should be good. And honestly, that's a really shaky foundation. That's not what your body was built for. It's not optimizing your physiology, and it's not addressing other underlying conditions or root causes for them. So we want to shift that out. That pharmaceutical should be, second floor or third floor. And by the time we build up to that on a strong foundation, they're going to be really effective. So there is a time and a place for every sort of intervention, but we really need to be addressing those foundations of health at every visit and continue to bring them up. I mean, if you're a healthcare provider listening to this, continue to bring them up. It may seem like, a waste of time or silly to continue to say, are you drinking enough water? And hear yes back, and then say, how much is enough? I have a water bottle that I keep on my desk, and I say, this is 20 ounces. How many of those are you drinking? One. So they just told me they're drinking enough, but that 20 ounces is not enough of water. So we need to do better digging. We need to continue to ask the questions, and we need to support those foundations really intentionally. I like to tell my patients, if I could bottle up the foundations of health into a little orange pill bottle and send it to your pharmacy, you would take it every day. And now it's not that easy because there's a lot that goes into habits and lifestyle. And also that's how important this part of the practice is. So again, when we're looking at foundational health and how it affects the progression of Parkinson's disease, this is backed up by research. And I want to take a moment here and pause and show another debt of gratitude and just so much thanks and appreciation for my mentor in this field, and that's Dr. Lori Mishley. She's really spearheading the integrative approach for Parkinson's disease globally. She's the host of the Parkinson's Disease Summer School every year in Seattle, Washington. And between her and Dr. Sam Evans, who really is spearheading the GI research of Parkinson's disease, getting this data and this information is just, it's worth everything. It's to know and to be able to show your patients like, hey, this is important and you need to take this medication. And also, here's how these lifestyle interventions are affecting Parkinson's symptom severity. So you can see that, the graphic on the left there that's showing how food and loneliness and community and cooking and exercise all affects the symptom severity of Parkinson's disease. So while we know there is absolutely no pharmaceutical out there on the market that is slowing progression, they're just masking symptoms, which is really important. We need symptom suppression, we need symptom management, but nothing out there is really slowing the disease marching on in your body. We know that these things actually do. They're slowing things down. And then again, we can divide this Parkinson's plate up into so many pieces, say foods associated with the fewest Parkinson's symptoms over time. And when I present these graphics to patients, they look at it and they go, oh, I can do that, right? And it's when we think of lifestyle changes and diet changes and exercise, it can be really overwhelming. So going back way back to those first slides. And when you present it in a way that says, here's what I'm asking you to do. I'm not here to take a bunch of stuff away from you. I'm saying, what if we focused your plate on these foods instead? What if instead of 3 days of exercise, we actually did it 5 days a week for 30 minutes? Because the research shows anything less than 4 actually isn't beneficial. So exercise is dose and frequency dependent, just like your medications. Is anybody telling you that? Are you feeling educated on that aspect? Here's what we're looking for. On top of all of that, if people with Parkinson's answer the question of if they're lonely, yes, I'm lonely, regardless of marital status, community engagement, community support groups, the list goes on and on. If they feel lonely and isolated, we know that, especially through research through the pandemic, that one statement will actually override everything else positive that you could be doing. So we have all of these positive, progressive, these things are going to slow progression down in a positive way. But if somebody is lonely, that will almost negate all of that benefit. So again, asking these questions is, how are you? Are you feeling supported? Are you feeling lonely? Do you feel isolated? And how can we help with that? Whether it's counseling work, whether it's marriage counseling work, whether it's connecting somebody who may not have any family with a resource or a support group in the area. That's another thing that, I've done within the HIPAA guidelines is said, hey, this person is lonely and this person is lonely. And if they both say, yeah, I'd like to meet somebody else, then hook them up, right? I have a side business of connecting people with Parkinson's and their caregivers with somebody else that might be really beneficial for them to know and meet. So I don't take that lightly as far as like, oh, that's sad, you feel lonely. I'm saying this is actually affecting your disease progression. So what can you expect from your naturopathic doctor? Here are the treatment tools that we're well equipped to deal with: prescription medication, botanical medicine, natural medicines, nutrient supplementation. Yes, those are different. Body work and counseling. Those are the foundations of what every naturopath is trained for in school. Now, some have gone on to get more qualifications or certifications. Again, go back to the beginning and say, hey, what do you do here? What's your specialty and what's your focus? So when it comes to prescription medication, we have the training in the pharmaceuticals, and especially somebody who's well-versed in treating Parkinson's disease, we know how to not only prescribe, as long as we're licensed in the state that you are, medications for Parkinson's disease. Not only that, is we're really well qualified to manage the side effects. And the first line therapy for side effects of some of our major medications for Parkinson's disease is often another prescription. And I think this is where we really come into play with that polypharmacy hamster wheel that we often see go on. If, well, I take this and then I get nauseated, now I have to take this for my nausea, and now this has shut down this other biochemical pathway. So now the list goes on. And I see this so often in my practice. And where naturopathic medicine is really shining here is that we have so many tools to manage these side effects of medications that are necessary, life-saving, quality of life-saving, but now we can manage these side effects without adding on to that polypharmacy. The types of botanical medicine that we can use: tinctures, teas, capsules. Oftentimes, in a clinical practice, they can formulate these medications just for you. Botanical medicine is an extremely potent form of medicine. It's, the mother of all medicines. That's how we actually got to synthetic drugs, is, hey, if I isolate this one thing from this plant, can I get pain relief? Oh yeah, good job, willow bark. Now, the cool and amazing thing about plants is their synergy. So while we isolate for synthetic medications, and even sometimes for botanical medicine, oftentimes parts of the plants will work actually better together in your body composition and be even more effective with a lower side effect profile. So these are things, again, that we're trained and experts in prescribing. Uses for botanical medicine, I really just put 4 there. Those are the 4 most common ones that I'm using it for with my people with Parkinson's. Again, before I go to yet another pharmaceutical for these really common symptoms that patients are coming to me with, we can use a gentler form of medicine to work on those same systems without, again, confounding that polypharmacy. I want to take a minute here, of course, and talk about the natural source of levodopa. It's one of the most popular questions I get in my practice. Hey, I don't want to take any drugs. I want to go all natural. I alluded to it before. Natural doesn't always mean better. The FDA doesn't regulate our supplementation industry right now, and there's arguments on both sides of that. However, Mucuna pruriens, which is really well known for its high concentration of levodopa and is bottled and manufactured as a dopamine medicine out there in the industry, is really hard to regulate. There's a couple different ways that we're not regulating it well, between companies, between capsules even, and between bottles within the same company. We can't guarantee all the time that these have met label potency. So therefore, it's really hard to standardize the dose that's required, especially when initiating levodopa prescription. So when I first get somebody with Parkinson's disease that is medication naive, to start with Mucuna can provide a little bit of a challenge because of that lack of standardization. So one day they may feel like they need to take more and the next day less, and maybe they're having some side effects here and there. The other kind of con of taking this right off the bat is that Mucuna has a lot of levodopa in it, but it doesn't have the carbidopa aspect of it, which is paired in your synthetic medication like a Sinemet or Rytary. And that carbidopa aspect, when paired with levodopa, actually helps it from binding to the levodopa receptors in your periphery or the rest of your body, and it keeps it reserved for that brain receptors, so we get more impact from your symptoms of Parkinson's disease. Now we can pair Mucuna with green tea, which is high in carbidopa, and you can talk to your doctor about that if that's something you're interested in. And how I'll often use Mucuna and green tea is more of an adjunct. Hey, we got to this really nice dose of Sinemet or Rytary, or your primary levodopa source with carbidopa, and now you're having some off periods, or we're noticing a little wearing off, or you have a stressful day coming up. Now we can supplement here. See, this is where that kind of comes into that natural medicine / supplement. We can supplement you with a little bit of levodopa and start to bring that in as adjunctive care, so we don't have to amp up your dose on the pharmaceutical side. Now, what I will say, one more caveat, is that I do know quite a few patients who are managing their Parkinson's disease quite well only on Mucuna. So it is an option. I'm not trying to say that it's not an option. I just, again, want to educate you on how this can be utilized and some of the obstacles that come along with it. Natural medicine versus nutrient supplements. We're really looking for nutrient supplements are there to supplement. You don't have enough B12, let's supplement. We know that levodopa medication depletes the body of B12. So really, we want to make sure that everybody has ample B12. That's where we are going to supplement nutrients. Hey, you are low on vitamin D. I'm going to supplement that nutrient for you. Natural medicines are a natural form of some sort of medicine that we're going to use to either palliate symptoms or treat an organ system. So it's used similarly to a pharmaceutical medicine. Oftentimes they have a lower side effect profile, but that's really like where I like to highlight that they're not always benign and safe, and they do need to be used and prescribed in a certain way. Oftentimes what I'm seeing more than anything is people on a lot of great natural medicines. They've done their research, they've acquired all these natural medicines, but they're taking them at maybe 1/10 of the dose that you would expect it to have its therapeutic effect. So again, the research, the dosing, how to take it, how not to take it is really important to chat with your doctor about, because these things do matter and they can be extremely effective for managing conditions when used appropriately. I want to take a moment here when I talk about nutrient supplementation and nutrition. You know, nutrition isn't just the food that we eat and what we put into our mouth. This is, you know, our sunshine, how much sun we're getting. Gravity is a nutrient that we need for life. You know, we know for a fact that when the astronauts go to space, they come back with osteoporosis and weakness and deterioration, and then that is reversed when gravity is reintroduced. Metabolic balance, social contact is a nutrient. So this is just a small aspect of it, but when you're talking nutrition and how you're nourishing your body, try to open up that span of what that means. And again, as a care provider, we also need to be doing that. Just because they don't have any deficiencies on paper does not mean that this person is nourished. When it comes to body work, again, there are so many different flavors out there of what works for you. And as a naturopathic doctor, I really love to educate on the differences between them, to be able to explain what it even means and to guide somebody down the correct path of which modality they might want to look into first. So again, there's so many different ways that we can do body work and physical support for the body, of course. especially the body with Parkinson's. A colleague of mine that I just adore, Dr. Nate Coomer, he has a website called the Parkinson's Fitness Project, and he does something online. You can do a free 30-day trial of his daily dose PD, and he does both cognitive and motor workouts. So while you're exercising, you're also exercising your brain. And there's just a boatload of research out there about the benefits of this kind of therapeutic for somebody with Parkinson's disease. And he's an expert in the field. And like I said, he's got his online website and YouTube videos and all kinds of resources for you to get into there. Counseling, I alluded to it earlier, we just can't minimize the effect and the need for counseling with our people with Parkinson's. Anxiety and depression obviously are very, very prominent in this population. So I really enjoy having these conversations with not only the people with Parkinson's, but also their care providers. Hey, how are you identifying this with this disease? How does this make you feel? What are you experiencing here? What is your, conditional worth value? What is your previous traumas? And how are you relating to this? Because it's really important that we're talking about this when we're talking about vagal nerve dysfunction and how that vagus nerve that is supposed to be active when we feel safe and supported, that puts us into the rest and digest, that then creates those digestive enzymes and gut motility. And, the list goes on, that if that upstream is being impeded by some sort of trigger or trauma, then that really needs to be addressed. So then that person can then experience safety and calm and restfulness and then healing. That's when healing happens. Again, a really common phrase that you'll see in the integrative care world is patient-centered healthcare. Hold people to that. Hold people accountable. Not just him getting the information and education, making shared clinical decisions. I'm part of my healthcare, and I'm being told even by my naturopath, hey, there's a pharmaceutical for this, and here's how it works, and here's the side effects. Here's the botanical version. Here's the nutrient supplement. Here's all of the options that we could go through. Here's the buffet. Here's what we can do. I just said, here's all the things that we're trained in. Now you should have access to all of those different modalities. Here's what we could do. Now you pick one, pick two, pick five. How are we going to do this together? And then hold them accountable to collaborate with your neurologist. I can say very confidently that every single neurologist and movement disorder specialist in my area, my local area, I have a wonderful working relationship with. We refer back and forth. We exchange texts and emails. Hey, what are you doing for this? And have you seen this yet? And I just had a conventional neurologist text me just a few months ago and said, hey, Karin, have you seen the recent study on sesame seeds and Parkinson's disease? And I was just blown away that this is so great. So that collaboration and being able to work together and taking away this idea that we have to be against each other in philosophy, it doesn't serve the patient. And more often than not, I will get patients and saying, I'm here to see you. And I'll say, hey, can I request records from your neurologist? Well, I don't know if they'd like it very much if I was here. I was like, okay, well, let's pause right there and talk about that. How are you advocating for yourself if you feel like your support team isn't okay with you getting more support, right? So let's dive into that a little bit, and let's also make sure that we are working as a team, healthcare providers, and sharing information, sharing concerns, and asking for more guidance, because none of us can know everything. But for the patient, all of us should be focused on their care and their value systems, their culture, what they are prioritizing in their life, to provide them the best services. So that wraps it up for why integrative care providers, what to expect from your integrative care provider. And just want to let you know, I do offer discovery calls at my practice. They're free 15-minute consults. If you have more questions, if you have concerns, if you're looking for somebody in your area, you can call our front desk here at the number, or you can email us and set something up, and we can have a chat, anywhere in the country. We can have a conversation, and we can help you find an integrative care provider that's right for you. If you're looking for a naturopathic doctor, let me move this little window. I don't know if I'm floating in the wrong spot again. You can go here to www.naturopathic.org, and then you click on that button over there called Find a Doctor. And then below here, you'll see, you put your address in and what radius you're willing to travel. And then you can find any naturopathic doctors in your area if that's something that you want to get started on. And then once you get there, you're going to ask, what is it that you do? Let's get started. Again, it's always a pleasure to be involved with the Northwest Parkinson's Foundation, to connect with all of you. I cannot wait to see you live and in person in Spokane this September. So take care and we'll chat soon. Oh, I wanted to leave off on this quote, one of my favorites. I was almost done. Thank God we have patience, or we would know nothing. So when I say thank you to the Northwest Parkinson's Foundation, but really, really more, just so much thanks and gratitude to the patients that have come into this office, that have shared their stories with me. They've shared what works and what doesn't work. I'm always a student of Parkinson's disease, and without you, I wouldn't be able to learn to help other people. And I think when we're talking collaboration between healthcare providers, please know that you're in that collaboration as well. And what you offer this community in this realm of care is invaluable. So now I'm done. Thank you.